us for our final HealthLinks webinar in 2021, Managing Diabetes at Your Workplace. I'm David Shapiro, Program Manager for HealthLinks, and I'm excited to welcome our panelist and keynote speaker today, and all of you joining us from around the country to discuss this chronic disease, diabetes, and how to better manage it at your workplace. As we get started today, I just want to make sure everybody is aware of a few housekeeping items. This is a Zoom webinar, so all participants are kept on mute throughout the duration of the presentation. If you have a technical issue, please use the chat function in Zoom on your toolbar, and a member of our team will help you get to the right technical assistance you need if there's any technical issues. And if for everybody just to practice and want to use the chat function, please log in and tell us where you're joining us from today. We're always pleased to see how we get participants from all over the country. I'm sitting in Denver, Colorado, and joined by my cohort of panelists and presenters that are also throughout the state of Colorado, but we want to hear from where you're from. So please use the chat function and tell us where you're joining us from today. We do have in our agenda time for Q&A, for question and answer with our keynote presenter and our panelists. And we always really get terrific questions in the Q&A box. So any particular questions you have for our keynote speaker and panelists, we ask you to put those in the Q&A section, not in the chat. And what's great about using Q&A is if someone asks the same question that you want to ask, you can use the thumbs up voting system to move their question and not have to retype the same question twice. So I'm assuming most people are getting familiar with the Zoom platform, but just want to make sure you're aware of Q&A and how you can vote on questions that are similar to the ones that you want to ask. We are recording today's webinar, and we will share it with you in a day or two following this presentation. And so you can have that and share it with your colleagues. You'll receive the link in our follow-up email. And please, there's a survey at the end of the webinar, which we will remind you of. As you exit the webinar, a survey will automatically generate and pop up. And we really appreciate the feedback that we get from those surveys. And for those of you that are claiming continuing education credits, especially CHES credits, it is required for you to complete that survey. So thanks again, everybody, for joining us and for putting into chat all the terrific places and all the wonderful places around the country you're joining us from. A little bit about us. I mentioned I'm David. I'm the program manager here at HealthLinks. We are a mentoring program, the signature public health outreach program at the Center for Health, Work, and Environment. And our center is located at the Colorado School of Public Health on the CU Anschutz Medical Campus in Aurora, Colorado. The Center for Health, Work, and Environment is one of 10 certified total worker health centers of excellence by NIOSH, the National Institute of Occupational Safety and Health. And we have a team of researchers and academicians and practitioners that really put total worker health into practice. And today we're talking about a key element of total worker health, which is health promotion and dealing with chronic disease. So we're going to talk a little bit about the Diabetes Self-Management Education and Support Program, DSMES for short, including how it promotes key behavioral changes in participants. So addressing chronic disease is really important for all of you that are health educators and in the well-being space. Chronic illness obviously has impact on the employees that face the illness themselves, as well as are often the biggest cost drivers for our country overall, but also for your medical plan. And so DSMES is one way for individuals who are diagnosed with diabetes to better manage their illness and ultimately save costs for having more difficult reactions to the illness down the road. So we'll also identify how to refer people with diabetes to a DSMES program. We're lucky here in Colorado that we have a medical home model through clinical pharmacies, and we have a few clinical pharmacists joining us today to talk about how DSMES can be participated in through local pharmacies. And then we're going to compare and contrast the effectiveness of online DSMES delivery versus an in-person format. And so one thing you'll hear is that DSMES has gone virtual, as so many programs have through the COVID pandemic. And so there's an opportunity for individuals wherever they are in the state of Colorado or around the country to participate in a virtual diabetes self-management education and support system. Diabetes is prevalent. There are 34 million people in the US that have diabetes, and another 88 million that are at risk or have prediabetes. So we're talking about a large swath of the US population, close to 50% of individuals in our country that are at risk of developing diabetes or actually have diabetes. And it's a costly illness, one of the most costly ones, if not the most costly illness facing our country. The costs have been estimated at $327 billion per year. That breaks down to $230 billion in direct medical costs and another $90 billion in indirect costs, which include lost productivity, lack of engagement or presenteeism at the workplace. So this is a major cost driver to our national economy. And obviously it impacts the health, safety, and well-being of individual team members that have diabetes. And I just want you to pay attention here to the difference in the annual cost of someone on a healthcare plan with diabetes versus someone without. So, what we understand is there's a baseline cost to anyone on your medical plan that's estimated at around $7,000 a year. That increases, more than double for individuals with diabetes. And so what we're hoping to do today is talk a little bit more about how providing management, education, and support for individuals with diabetes can help keep costs for individuals in check, and also overall how to keep them healthier and maintain a healthy lifestyle while having diabetes. And with that, I'd like to introduce our keynote speaker today. I'm honored to introduce you to Dr. Wes Neufer. Dr. Neufer is an associate professor at the University of Colorado Skaggs School of Pharmacy, located here in Aurora, Colorado. He's an assistant director of the experiential programs, where he works to place students in various pharmacy practice settings across their curriculum. Currently, Dr. Neufer is working on a variety of funded initiatives involving transforming community pharmacy practice to patient-centered care models. Dr. Neufer's experience is in experiential education, diabetes, obesity, and immunizations, and his clinical practice in the endocrinology department at the University of Colorado Hospital. In his spare time, Dr. Neufer enjoys the martial arts and the great outdoors of Colorado with his family. And I want to thank you, Wes, for joining us today, and I'll turn things over to you at this point.
Thank you, David. I appreciate that introduction, and greetings to everybody. We appreciate everyone joining us today across the country and beyond. I think I saw somebody from Jamaica and someone from Puerto Rico. So very exciting to have you all here. I'm going to just touch on diabetes a little bit, and then I want to save some time for you to talk to our clinical pharmacists and hear a little bit about what they do in their stores. What I can tell you is that pharmacy practice is very much changing, and I am very motivated, as are faculty members across the United States, to help push community pharmacy forward. We train our students today to have a doctorate degree and to have very, very good clinical skills, and the traditional dispensing role for pharmacy is going away. Largely, it's not even a profitable business anymore. And so I belong to a couple initiatives. I'll talk about one of them today called Flip the Pharmacy, which is really transforming away from filling prescriptions at a moment in time to caring for patients over time. And really what it comes down to is that there's huge numbers of data that show medication-related errors and overlaps and transitions of care, and a lot of places where pharmacists can help touch the patient and help avoid bad outcomes around medications and collaborate with the rest of the medical team. As part of that, chronic management of disease is a role that we're starting to get in more and more, and that's really what I'll talk to you about today. All right, so David did a nice job of already going over the learning objectives, so I won't belabor them, but I do want to describe what DSMES is a little bit, and then describe the virtual program with that. I also did put together similar data to what you just looked at, just to again re-emphasize the scope of the problem. The 7.3 million people that are walking around in the United States that don't even realize they have diabetes. And as I practice in endocrinology, I have my certified diabetes educator credentialing, and we know that the earlier we can intervene and the earlier we can catch someone within this diabetes spectrum, and specifically for type 2 diabetes, the more options we have. And so that really is key, is number one, identifying these folks, and then getting them into care and understanding their diseases so that we can begin to impact the bottom line, which is the dollar amounts that you can see here and that David presented. So some of you already know this, but I want to take a minute to just really recognize just how self-managed diabetes is. So your typical patient with type 2 diabetes, and with type 1 diabetes for that matter, has a huge burden on themselves every single day as compared to everybody else, and we just go through our lives. And so these are just a few examples. So every meal, I have to be careful about how much carbohydrate I'm taking. There's a balance between the energy you put in your body and the energy that you're able to burn through exercise, as well as what we can use medications to manage glucose. But when we're really talking about sugars and glucose, we're really first and foremost talking about carbs. And unfortunately, the Western diet is very carb centric. And so it's very, very easy to overwhelm the body with too much carbohydrate intake. And that's really one of the first things that we educate our patients about is, number one, portion sizes generally are too large. I've been struggling with that. My wife and I are on an eating program ourselves, and it amazes me how I used to eat compared to what you're actually supposed to eat and what you're served in restaurants. It's just a serving portion is a very key aspect to educating somebody, because we all consume more calories than we should. And so that's a good place to start. Physical activity is something I do teach the obesity section in pharmacy school. And this is something that we talk about all the time, where up until the last probably 5 to 10 years, food acquisition or getting food, at least you had to get up and move in order to do that, right? But nowadays, all I have to do is grab my smartphone here, and I could dial into Jimmy John's and they could walk in the door and hand me food without me ever getting up from my desk. And so even food acquisition is no longer something you have to expend energy in order to do. And we have copious amounts of relatively cheap food available everywhere. And so there really is an imbalance between how active we are. If you look at labor and you look at what people do for a living, we're much less active than we were even 10 years ago. I tell the students, ask your grandparents if an hour a day of physical activity is a lot for them to have done when they were in the workforce, and they would laugh and say no, because we were all very active and physical and doing labor and doing those types of jobs, but now are very sedentary. And so I use that example because at the most recent exercise talk that I went to, that is really the sort of the goal for maintaining or losing weight is 60 minutes a day of activity, 7 days a week. And there was sort of a collective gasp in the audience, like, how dare you tell me that much exercise? I'm not a big fan of that recommendation because people sort of tune out. I think some of you've tuned out from me now because I don't have an hour every single day of the week that I can dedicate to my own physical health. I wish I did. I certainly have days that I can do that, but I also have days where, I'm looking at my steps at the end of the day and I'm around 2,000, and those are the days you got to get the dog out or whatever it is, whatever it takes. So staying regularly active is very key. And the approach that we use is we get a baseline of what you're doing, and then we add little things here and there. Take steps instead of elevators, park farther away, try and arrive somewhere 5 minutes earlier so that you can walk, and those types of things. But we really want to get to the heart of balancing activity with food intake. In addition to that, now you have all of the things that the disease demands. So you have foot exams, you have kidney exams, you have A1C checks to check what your sugars look like. You have eye exams that need to be done. There are very clear microvascular and macrovascular complications. And when we talk microvascular, what we're talking about is small vessel disease. So it impacts people's eyes. Number one leading cause of blindness in adults. It impacts people's kidneys. It's the number one leading cause of end-stage renal disease. It impacts people's nerves, so that you can get a foot amputation because you step on something and you don't realize that you've injured yourself. Outside of accidents, non-traumatic events, number one leading cause of foot amputations is diabetes. And so you have all of these small vessel disease things you're worried about, but what really impacts your patients with diabetes is heart attacks and strokes. That's That's what they die from. And so cardiovascular disease is central. And as you'll hear from our clinical pharmacists, when you manage diabetes and your heart. We care about your cholesterol. We care about your blood pressure, because these are things independent of your sugars that are going to impact your life in very meaningful ways. And so these are the things that we need to teach people about, so that they recognize, why is it I have to do this laundry list of things? I have all sorts of patients that take holidays away from their diabetes. I just want to be like everybody else. I'm tired of injecting myself. I'm tired of sticking my fingers and reading what those things look like. I'm tired of evaluating every meal in front of me. I just want to go to a buffet and eat what I want for a change. And unfortunately, those lead to bad outcomes, as I just described. And so it's very, very important that we educate people on why the work is worth it, and on how you can conquer this disease and live with it and live a healthy, long, normal life by integrating these things into your self-care behaviors. And so again, my goal here is just to take that moment to recognize that your person with diabetes in your workplace has a lot on their plate that they already have to do, and that they're responsible for, and we're asking them to do this in a way that manages their disease, so that they avoid these bad outcomes from happening. And it's by far not easy, but the very first step is learning what to do. When I have someone newly diagnosed, it's overwhelming. And in fact, they only hear about 1 word out of 5 I tell them, because they're sitting here like, I can't believe this is happening to me. I can't believe I have this chronic disease. I knew someone who had this, and they went on insulin, and then they went blind, and then it killed them, and they're shell shocked. And so by meeting with them a little bit at a time, we're able to demystify the disease. We're able to teach them that it can be managed. And I think most importantly, these courses put them with peers that have already been through some of the struggles that your newly diagnosed person is facing. And there's nothing more powerful than having somebody with the disease say, you know what, I've been there, I've done that, and here's what I was able to do. And little by little, the shell shock goes away, and you begin to realize that this is something that you can do and something that you can manage. All right, so our education series is really based on the ADCES, used to be AADE. It's the Diabetes Educator Standards. And they put out a textbook that has basically these key focus areas that you go through and integrate through the curriculum. So as you see, healthy coping, this is something that's very, very new to, this was released in October of 2020. And really what we've recognized is, independent of all those things I showed you, it's a stressful disease, and people just can get depressed. They can be overwhelmed, and it can really affect their emotions and their mental functioning. And so we need to make sure that throughout all of what we're talking about, we also give them strategies on how to keep yourself happy and how to keep yourself mentally coping with a very difficult chronic disease. As we move forward from there, we already touched on the healthy eating, its portion sizes. It's also avoiding certain key foods, both from your sugars, your glucose perspective, but also, again, from a cardiovascular disease perspective as well. One of the newest fads is going very, very low carb. And that actually works very well for someone who has diabetes, because, as I mentioned, carbs are your main sort of nutrient that's going to raise your sugars. But there's only 3 macronutrients: fat, protein, and carbs. And unfortunately, when you go low carbs, you need a lot of education about how you're going to replace those calories, because doing the old Dr. Atkins diet, where you're eating bacon and eggs and sausage and all of those high fat foods, can really affect you cardiovascularly and from an insulin resistance perspective. So there's a lot to the healthy eating part of the curriculum. Being active, I touched upon. Again, consistency. We want you active every single day. The recommendations we start with are 30 minutes a day, most days of the week. And that's very intentional, because what it was taught to me, it was 150 minutes a week is what is a healthy starting point. But, you know, I think I always say men, but if you give me 150 minutes a week, I'm going to go out right now. I'm going to work out for 150 minutes. I'm going to say, I'm done for the next 6 days. I can sit around and do nothing, and I've met my goal. And that's not what we're trying to do here. What we're trying to do is say you're active more days than you're not active. And so it's really changing your lifestyle to make sure you're getting up and moving around every day of the week, to make sure that your body is handling sugars and responding to insulin better because of that activity. moving from that, taking your medications. Obviously, this is one of our strengths of our program with our pharmacists. There's so much information around taking meds and balancing your meds and recognizing when meds aren't working right, or when we've given you a regimen that's way too complicated and people are missing doses or feeling bad and not taking it. Adherence is a huge issue in healthcare. It's a huge area for pharmacists, making sure that patients are taking the meds they're supposed to be. And our job is to simplify things to make it easier for you to be adherent. And there's all sorts of data around that. And the Surgeon General years ago made the statement that meds don't work in people that don't take them. And this is a huge area that we need to revisit regularly. The data suggests that anybody, a pharmacist, a nurse, a healthcare coach, even a peer, can help impact adherence positively. We can help somebody take their medication, but it's only short term. If I sit down with you and work with you today, then 2 or 3 months from now, you might be right back to baseline. And so it's a conversation we need to continue to have, and not just have it one time and think that's going to change someone's behavior for the rest of their lives. Monitoring used to mean just the blood glucose, where you would stick your finger and it would give you a reading. Monitoring has now evolved wonderfully to where we have these sensors that can alarm you when you start to go too low. You can wear it and know at any point in the day or night what your numbers are. I believe in the future that every patient with diabetes will have a continuous glucose monitor. Our type 1 patients are well on their way. The biggest barrier here is coverage. They're expensive, and the health plans are just slow on coming around to recognize the benefit that these offer, but they're a huge, tremendous benefit to our patients. And we work to get anybody a monitor that we can, and reduce the finger stick load, which in some patients can be very, very high, like 6, 8, 11 times a day. You're having to stick your finger with a needle and draw blood. And these sensors avoid a lot of the need to do that. Reducing risks. So I talked about the different risks involved with diabetes. It's important to understand what happens if you ignore the disease. It will get you in the end. And so we're helping to help understand what these are and how you can address these and again, beat the disease by making sure that you're getting your routine examinations, you're keeping your glucose in a good level, and you're managing your disease and doing all of the things that we've just talked about. And then finally, problem solving. So this is sort of our last. All right, well, you have all the tools in your tool chest. Let's give you some examples. How are you going to deal with going to the Super Bowl party? How are you going to deal with a huge buffet in Las Vegas? How are you going to deal with your cousin's wedding? And these are all times when these are very challenging, and people want to socialize and have a good time, but you still want to try and keep your disease within control. And so these are the sort of strategies we can give people to help them understand how to go through this. And as was mentioned, it's all now done remote. And so I'll talk a little bit more about this, but it really does allow us to reach a much larger audience and to help people access us from wherever you're at. So you no longer have to calculate in travel time to a pharmacy or clinic and back. You can log in during lunchtime, or you can log in for an hour and do it from the comfort of your own home. So I think there's definite advantages to that level of delivery. So DSME or DSMES is an acronym. You'll also hear DSMET for treatment. Basically, this is a standardized approach to educating patients. It is covered by Medicare, and it's covered by several commercial insurances. It's standardized at 10 hours of education at one point in a person's life. So if they've never received this, they're eligible for it. After that, then there are follow-up sessions annually that you can use to sort of reiterate this. It wouldn't be 10 hours, it's less than that, but there are 10 hours available at one point in time. So that's really where we're focused on for now. The very first session to that is individual. So you would get to know one of our pharmacists and they would build a plan for you. They want to know everything about how long you've had diabetes, what you've tried, what you haven't tried, what you know, what you don't know, what your goals are. We are here to really help you understand your disease, and people are here for a reason. So we want to know what that reason is, and we want to make sure that we're coming back to making this meaningful to you and that this is valuable. We have all of these laundry list of things we'd like you to know, but what is it that you want to know? And so that's really where we get to know our patients and get to know what your goals are. And then we set smaller goals at each session to help you attain better control. And so that one-on-one session is really to get to know the person, to know their labs, to individualize the education before we transition you into the rest of the 9 hours, which is really a group interactive session. As I mentioned before, a lot of this is really peers interacting with each other. And so what our pharmacists aren't doing, Rodney and Dana are not just sitting here and teaching you like what I'm doing right now, right? It's not interactive. I don't even know if you're online shopping at this point, and completely tuned me out. So what they are, they're facilitators. And what they do is they facilitate discussion amongst the participants, and then you learn from each other. And so you learn what struggles people have had and how they've overcome it. And in a perfect group, we have someone who's had diabetes for 20 years, someone that's had it for 20 days, and then the spectrum in between that. And so we have rich conversations from somebody who's been through it all and really, really hopefully learned how to beat these things. And we've also had someone who's brand new to it. And that peer interaction, that ability to have others sort of for you to lean on cannot be understated. I feel that's the very strength of this program, is that peer group facilitation where everybody talks about these things together, and you really learn some strategies that other people have tried, and you realize you're not the only one going through this, and you realize again why it is that you have to do these things and why it's important for you to work so hard. And that's really the format for the rest of the sessions. And then, as I mentioned, then yearly follow-up education with the pharmacies after that. Doesn't just have to be yearly. I will talk a little bit more about it, but really what we're invested in is we're changing what pharmacy looks like. So you walk into Rodney or Dana's store and somebody who takes you and sits you down and they measure your blood pressure just like you would at an urgent care clinic. Somebody prints out your list of medications and your vaccines that you've received. And then the pharmacist comes out from behind the counter, sits down in a private room and says, good afternoon, Sally. How are you doing today? Let's take a look at how things are going. I notice you have a new prescription. Let me tell you what this medication is for. I did have a question about why you're on 2 of these drugs. It seems like they do the same thing. Can you tell me more about this? And it's really utilizing the pharmacist's expertise to push forward and help manage a person's health and avoid medication-related problems. And that's a new concept in community pharmacy. It's an exciting one. It's a rewarding one. Our students are graduating wanting to do this work, and we're the most accessible healthcare person available. So we see you when you're sick, we see you when you're healthy, and we are right there to be able to make sure to try and keep you as healthy as possible. So we talked a little bit about costs amongst ourselves. The reason I bring this up here is that generally speaking, with Medicare, a patient is responsible for 20% of the reimbursed costs. So depending on the session, it could be somewhere between $10 and $20. At this point, the nice thing is we're really trying to build our cohorts. And so we will be having conversations as we find out who our participants are and who their third-party insurers are. We will have conversations with those insurance companies to see if we can get reimbursed for the time. But at this point, this is really available for your clients and your employees without a cost. We recognize that some insurances don't reimburse pharmacy. We're very new on the landscape of offering these things. And so the good news is that we really want to get the classes rolling and get the cohorts going, and then begin to really go to the insurers and say, we're doing this work, we're providing these, we're saving you money. You need to be paying pharmacists to do this work. And so while the fee structure is a 20% copay for Medicare, people that are in the workforce generally don't have Medicare. And the good news is we aren't going to turn anybody away. We want all comers at this point to build our reputation, to build our classes, and then we will begin to transition and go after the payers to justify the fact that this is work that needs to get paid for. So you have a nice window of opportunity right now in pharmacy for the next year or so, where it's available at little or no cost to your patients. And then eventually, hopefully, we will get on the landscape with every other provider to be recognized for payment across all of the different third-party plans. All right, so opportunities and challenges. The opportunities for delivering an online program, I've already referred to a few, right? So wider audience reach. I'm talking to people, and I think I counted at least 30 different states and countries. I couldn't do that face-to-face. And so the reach is wonderful. And the easier access is also a very nice perk. The idea here would be that perhaps the participant could do this within their workday. Perhaps they do it on their lunch hour or right before they clock in or right at the end of the day. And these are ways of supporting them through work to be able to participate in these types of programs. Social distancing, that's a new one, but it's an important one. Every time we think that we have a handle on this crazy pandemic, it pushes back. And so I still very much want to limit my family's access to large groups, and especially when you're talking chronic disease, if we can avoid putting everybody in one room, we want to do that if possible, as long as we get the same benefits. And that's where the challenges come in. The first challenge is reliable internet, right? So any of you who are health educators, you know that it's great that DSME is going virtual, but especially as we get into our rural areas, can our patients even get on and access us? Can they hear me, or am I chopping up into where it's nonsensical and it's not even meaningful? And so that's a challenge that we're constantly trying to overcome. We're looking for health centers that may have better internet where people can go in a rural community, maybe as a group, and then log in as a group to interface with our pharmacists. Group dynamics themselves are challenging, right? I make my students turn their cameras on. My son was at home all last year and he's in middle school and none of those students had their cameras on. And I have firsthand experience presenting to a bunch of black screens or pictures. It's hard. I'm a dynamic presenter, but I want to see people smile. I want to see people laugh at my jokes. And when I'm staring at a bunch of blank pictures, I have no idea what you're doing and if you're enjoying me or if you're falling asleep and you just can't wait for me to be done. And so these are the challenges. To overcome that, we really are working. We will turn our slides off. We will have the larger view where you can see each other, and we ask that the participants turn their cameras on if they can, so that you get to see each other, and we maintain one group. We don't add members, class by class, because we create a nice group dynamic where you know everyone in your group, you look forward to seeing them, you're friends with them, you may exchange phone numbers and text each other, and we really recognize the value of that. So we build these groups to be independent of each other, so that the people within it, they grow together, they grow to know each other, and they sort of take this journey together as a group. And that's really a lot of the focus that we've done as far as training our pharmacists on how to facilitate this, to still get that strong group interaction in a virtual setting. All right, so the last thing I want to touch on, and then I'm going to turn it over to the folks that are doing the hard work, is this Flip the Pharmacy initiative. You've already heard me talk about this. Pharmacy practice is moving away from me dispensing drugs to you and handing you a bag and maybe a little bit of free advice on your way out the door. In the pharmacies of today, our pharmacists are sitting down with patients, they're vaccinating patients, they're measuring blood pressure, they're measuring cholesterol, they're measuring A1Cs, they're helping people get started on these sensors, they're helping people learn how to give injections and how to manage their difficult delivery devices, and really working with the patients face to face and being educators. And this is a huge transformation, and it's very exciting. It's right at the beginning of this. You'll see a lot more as you move forward. But if I was a patient, I would go to one of these pharmacies, hands down, where they know my name and they're going to sit down and they're going to talk to me, versus going in somewhere where you may not even see the pharmacist. He's so far in the back of the shop and you're just coming in to grab something and leave. So it's exciting, and I know that you will see it. It's not just a Colorado thing. It's national, it's international. We're really working to redefine what being a pharmacist means. And I look forward to you all seeing how we can help positively impact all of our patients' health over the next 10 plus years. And with that, I will turn it back over.
Thank you, Wes. Really appreciate the setting the stage here and the presentation. So we're gonna try and keep you all engaged a little bit by launching a poll right now. So our team, if we don't mind, if we can launch that, it's we want to know if your organization currently has any initiatives that are focused on diabetes. So yes, no, unsure. We're trying to figure out here the scope of what's available to individuals in your network, individuals at your place of work. Seeing a lot of great responses here. Really appreciate everyone filling this out and staying engaged. We'll give it just another minute or so before we introduce our panelists for today. Great. I think things have slowed down. If we can share results. And it looks like about half of you are saying that you do have some initiatives focused on diabetes. And then about 30% says that you don't, and another 20% are unsure. So that's really good information. And, we're hoping that you can add the DSMES and what we're about to talk to you about to the scope of services that are being offered at your organization or workplace. And if you're a no or not sure, we're hoping you can get in touch with us to figure out more and find out more about what may be available based on your workplace where you're located. With that, we're going to introduce our two panelists today, Rodney Diffendaffer and Dana Sadowsky, both clinical pharmacists. Rodney's at Flatirons Pharmacy, and he's certified in several fields of pharmacy. He enjoys new directions and challenges in pharmacy, and preventive medicine is really what he preaches by providing health and wellness clinics that deal with male and female hormones, thyroid, cortisol, and healing the gut and stress. Rodney also provides classes on diabetes, prediabetes, and smoking cessation. He's been a healthcare professional since 2017. And in 2021, Rodney has done close to 5,000 COVID antigen tests, 500 antibody tests, and 5,500 COVID immunizations. Thank you, Rodney, for being on the front line of working towards COVID immunity in our country. And his goal and mission is to find the root cause of disease and not just treat symptoms. And I'm also pleased to introduce Dana Sadowsky. Dana is an independent clinical retail pharmacist at the Clear Spring Pharmacy in Denver with a Doctor of Pharmacy degree from University of Illinois at Chicago. She started her career at Doc's Pharmacy in the southern suburbs of Chicago before moving to Colorado in 2017. Dana directs the clinical programs at Clear Spring Pharmacy because she believes that community-based pharmacy practice could and should be different. We're starting to learn more about that today. And when not working, Dana enjoys long-distance running, planning travel, and taking off to anywhere and everywhere with her husband, as well as exploring craft breweries around the country. So thank you both, Dana and Rodney, for joining us today. If you have any questions that come up while our pharmacists are talking to us, please put those in the Q&A, and also any questions for Wes as well. We start to see some questions there. So Dana, we're going to start with you. Please tell us a little bit about yourself and how you and Clear Springs Pharmacy is approaching DSMES.
Yes, thanks, David. Hello, everyone. Like I said, I'm Dana Sadowsky. I'm a pharmacist at Clear Spring Pharmacy in Denver. We also have a location in Littleton, Colorado. I know you guys are from all over the place, but anything that I discuss, there's pharmacies all over the country that offer these same services. So definitely seek them out because it's a unique opportunity that a lot of patients don't get to be a part of. We dispense a combination of traditional medications as well as compounding medications. So those include like hormone replacement therapy and just individualized medications for each patient that we make specifically at the store for them. And again, those are all over the country. We also mail out to quite a few states as well that we're licensed in. Beyond dispensing medications though, as we've kind of been discussing, retail pharmacy is changing and we offer a lot of services. These include immunizations. Yes, COVID-19 vaccines have dominated the store lately, but we also do your regular routine vaccines and of course, travel vaccines too. And we do blood pressure screenings. We do compression stocking fittings. We have a MedSync program. So Wes kind of talked about the whole process of coming to the pharmacy, picking up your medications and sitting down with a pharmacist either once a month, once every 3 months to get these screenings that you need, go over the medications or immunizations that are needed at that time. Can be like a 10 to 15 minute conversation with them. But when your medications are already on the same day, then it's very convenient for you instead of coming to the pharmacy multiple times throughout the month. We also do point of care testing. This can include for diabetes, like A1C, cholesterol screenings, flu, strep, and now, of course, COVID-19 testing, all included in these point of care testing that we can do. And then recently, we have started these diabetes education classes. We became accredited a little over a year ago to offer them. And I really think they're a great opportunity. A lot of people will say, I already go to my doctor, they tell me all this stuff, but you're really probably meeting with them for 20 minutes or so, and the doctor's sitting there kind of getting through the things they need to quote unquote lecture you on. And these classes, as Wes touched on, is really more interaction between you and other patients. And we just facilitate the process. Of course, we're going to educate you on what you need to know. And we're going to, make sure that correct information is being given, but we're not going to sit there and lecture you on what you should and shouldn't do. You'll be able to interact with other classmates about what's worked for you, what hasn't worked for you, what your struggles are. Because if you're having that struggle, I'm sure someone else is having that same struggle. And maybe they figured out how to combat that struggle, and that can give you tips in regards to your diabetes care. I've seen firsthand how successful these classes can become. We had a patient go through the class. She lost over 20 pounds, and we were able to decrease her blood pressure and cholesterol medication in half after just seeing her for a few months. So really the key for her was finding what she enjoyed doing. The whole idea of exercising an hour every day for 7 days obviously is very overwhelming to people. And they think of going to a gym, standing on a treadmill or standing on an elliptical machine. That didn't interest her at all. So we had to find something that she was going to be willing to partake in, and it was riding her bike. Of course, this was kind of during COVID, so we didn't really know what was safe and not safe at the time. So we had to kind of strategize. But obviously being outside was a great thing to be doing at that time. And Colorado has decent weather most of the year. So she was really able to take advantage of that. And after putting in a lot of miles on her bike, she was very, very successful with the program. And again, it was just being able to work with her, throwing around some ideas. So like I said, I really have seen the success that people can have with these diabetes classes, and we're happy to help anybody out that's interested.
Thank you so much, Dana. I want to make sure that everybody realizes we're going to have some next steps and some follow-up available so that you're able to get diabetes self-management education and support classes in front of your organization, in front of people that you work with that have diabetes. So as follow-up, we have a separate survey that you can send out to team members so that they can enroll in a program that's available right now at no charge, like Wes said, through Dana and through Rodney. Rodney, please introduce yourselves and tell us a little bit about your work on preventive medicine and how Flatiron's pharmacy is approaching diabetes care and the other services that you're offering.
Hello, everyone. My name is Rodney Diffendaffer. Thank you for having me, David. Appreciate it very much. Wes, Dana, very good follow-up. I really don't need to say much because they pretty much said it all. Just a Colorado boy, 4th generation, born in Denver, brought up and birthed on a farm, went to couple different schools, graduated CU Pharmacy School in '95. Been working at Flatiron's Family Pharmacy since 2018. I was able to come in this job and was able to give a different role instead of being a pharmacist, which is counting pills, getting screamed at all the time, not having very happy people talk to you, dealing with those kind of people. I'm a clinical pharmacist. I was able to start building different clinical settings. Again, one of them was DSMES. So, I mean, I'm certified in compounding, certified immunization, certified in gene therapy, certified in DPP, DSME, smoke and sensations. We do all those kind of things. We do a lot of hormone replacement testing out of here. We employ our own nurse practitioner. So we have a complete circle. We do a lot of thyroid. Right now, cortisol is absolutely out of control for everyone. So cortisol seems to be the new panel that we're running on a lot of people just to see, because that high cortisol will lead to negative feedback on the body, which will eventually lead to diabetes, cardiovascular, everything else. So stress is not good for anybody. So my first thing to everyone is please try to de-stress. So I have a team. Specifically, I have another pharmacist that will be running classes. He's certified. I have a healthcare technician that will be helping them too. So between 3 of us, we have a team that is able to customize to that person. Again, their ethnicity people is multiple people, right? So let's say one ethnic group eats this kind of food, the other one eats this kind of food. We have to take there and decipher like who's what and what kind of food they eat. And then we break that down again and Wes kind of hit on the carbohydrate thing. Looking at personal behavior challenges is what I see being the biggest problem with anyone trying to change anything in their life. I don't care what it is. It's a behavioral response. And if you don't react to find out what that behavior that is producing the negative response, and we can't find out what that behavior is and change the behavior, there's no reason to have these classes. So I really tried to structure on individualized people, try to find out who they are, what's going on in their life, and then we try to individualize them to again, exercises for the heavier weight person, to a lighter person. I mean, everything is totally different on every person. So that's why I try to say this is not a one size fits all. So that's what my big deal is here out of this pharmacy. We don't look at you as a whole. We look at you as an individual, and that's what we really pride ourselves on. We want to find out what the cause is. Like I try to tell everyone, there's a cause to everything. So we can go to the doctor and we keep on getting fed pills and fed pills and fed pills. But if we look at diet and exercise, so we just better nutrition and increasing physical activity will change pretty much everyone's lifestyle just by those two things. So what does that mean? Going in your pantry, you're looking at your pantry, you got chips, you got crackers, you got, you know, I mean, just junk food. You open up your fridge, sodas, all this other stuff. So what we look at is, let's clean that pantry up. Let's put some vegetables in there. Let's take some of those carbohydrates out. Let's look at these other things that we can do. And again, you can call us anytime you want. We will be there for you guys anytime you want. And we have a specialized team set up for you guys. Again, I was given an opportunity to grow a clinical pharmacy. So I have a different opportunity than most pharmacies, but like we were saying, pharmacy is going to change here soon, and we're going to see more clinics coming up helping people. Because like we say, you come to the pharmacy once a month or once every 3 months. You come healthy or sick, it doesn't matter. Building relationships with the people really does help just them, because they know they can come to a person that is going to talk to them like a real human being, and being able to guide them, not tell them what to do, but help them achieve their goals. So on that note, I mean, I'm pretty much have everything I need to say. I appreciate the time again that you guys have given me. I want to give one example of a person that came through. We've had several people coming through the class. Started in 2019, but this one guy was highly motivated. And again, if you come into a class and you are on the fence, do I want to do this or not? Don't come to the class. But if you want to come to class and you really want to change, this guy was driven, because when he was told he had an A1C of 8.1 and he looked thin, he looked beautiful. He was an older gentleman, he was about 65, but he couldn't believe that an A1, and then he was labeled diabetes, and that label of diabetes really messed with his mind, and it really, really resonated in his brain, and he just couldn't believe it. So just coping with that, first of all, was the first problem. It's okay, you know what I mean, trying to tell him it's okay, we can reverse this. And we've even seen diabetes go from diabetes to pre-diabetes to no diabetes. So this guy, in his 6 months, lost about, I don't know, it was like 12 pounds. But his A1C from the beginning of the class was 8.1, and when he left, he was at 6.4. So he wasn't even labeled diabetic if he went back to the doctor at that time. So it was really kind of a cool thing. And then when he was slapping fives, he was going on. And again, I still talk to him regularly. He keeps on going. And then we want to have a conversation down the line, even if they get out of the class. I still want them to call. I still don't want them to tell me how they're doing every 6 months, every year. I don't care what it is, but I want to keep in touch with them too. So just it's really gratifying to see people going from a position where they really think they're in a bad position, and then helping them out and getting them back down to a non-pre-diabetes state. So
thanks so much, Rodney, for joining us and describing the experience as well. I know we're getting close to the top end of the hour here, and want to make sure that we address the few questions that are in Q&A. Really what I'm hearing is it's about establishing sort of a different relationship with your pharmacy and with your pharmacist than many of us have, a much more comprehensive approach. And I really appreciate the model that Rodney, you and Dana are talking about. You're right that many of us are in the pharmacy much more frequently than we are the doctor's office. And so appreciate you adding these services. I want to ask, I guess, Wes, there's a question about becoming a diabetes educator, finding out more information about how to support people with diabetes. Any suggestions for an individual that wants to learn more about how to be a diabetes educator?
Yeah, it's a great question, David. I think that there's a lot of room for anybody to help patients that have diabetes. There's opportunities to volunteer for a diabetes camp when we're not in a pandemic. There's ways of even as an MA, medical assistant, or a lay person to get involved and to learn about the disease and to help. To get the credentialed of CDCES, which used to be a CDE, it does require 1,000 patient contact hours over 5 years, and it does you have to log those with your supervisor. So there is a requirement that your job has to do with caring for patients with diabetes. Although recently they did loosen those regulations a little bit to where now you can also do some volunteer hours, which they didn't used to allow. So it is definitely an opportunity. It does take some time. I think it has to be 2 or more years that you're having that time. And so but there are intermediate steps you can take on the way. There's a nursing credential. Well, it used to be nursing. It's called a BCADM, which is a board certification, which requires 500 hours. So that would be a good first step for someone who wanted to be credentialed. But even independent of the formal credentialing, as I mentioned, there's plenty of opportunities. As Rodney mentioned, he's got a person that's a non-pharmacist that's really helping out and getting a lot of job satisfaction and working with these individuals. It's really about learning about the disease and being able to talk to people and listen to them. A lot of it is listening and problem solving. So I highly encourage it. The numbers are only getting worse, and it affects all of our lives. And so there's many ways to get involved. And I think, David, that you'll share my email. If someone wants some specific places that you can go and learn more about it, I'm more than happy to share those as well.
Great. Thanks, Wes. We will share contact information in the follow-up email. One of the things you mentioned was about being active more days than not active. And we do have another question about the importance of exercise and how different exercises affect diabetes. Dana, you talked about a story of someone who, decided that riding the bike was the right exercise for her. I'm just curious, is it different exercises for different people, different times? Like, how do you promote more activity for the people that are participating in DSMES?
Yeah, other than really finding out what the patient will actually enjoy doing, it is important to also kind of throw things off at a time, because obviously we know that if you do the same thing over and over again, there's going to be maybe a plateau, or you might get bored of doing that thing. So to throw in, whether it's yoga or strength, training, or other types of physical activity, walking versus biking, every once in a while, aerobics classes versus biking, it's definitely a good idea. One, to keep from getting bored of doing it. 2, we got to make different muscles move. If you're doing the same thing over and over again, you're only using the same muscles. And it's important to get all the different muscles in the body working. And then resistance training is important no matter what, whether it's for diabetes or for as we get older. It helps with balance, prevent fall risk, things like that. So definitely a variety is ideal, but I think the first step, even if someone is not exercising at all, is to really find out what they even enjoy doing.
Great. I really like that. Rodney, I want to ask you a question. There's a few questions in Q&A about individuals that work specifically with, it looks like truck drivers and long distance truckers, and that being sort of a prevalent group where diabetes and prediabetes is an issue. There's, a challenge with food on the road. I'm just curious if you have any tips or suggestions for this particular population of workers. If you've come across working with people who drive, we are going to, in our follow-up, have a selection of times and days that are available for the class. But I know that if you're on the road, that could be difficult even to pause and participate in. Any thoughts for individuals that could do coaching and work specifically with drivers?
That's a very good question. Again, drivers, they're kind of, put in a position where they are sedentary, obviously. So back in the earlier days, they were driving 12, 14, So nowadays the laws are changing it. So they're stuck, I think, to an 8-hour day or however many. So it's more structured that they cannot go and do the long days. So on those kind of people, even just getting to the food, when you go to truck stop to truck stop, you cannot find any good food, obviously. So you would have to start trying to find a better place to eat, first of all, besides the truck stops. Now that's going to be a problem. You're going to have to increase your exercise. How are we going to do that when you get done with your trip? What time do you stop? Do you stop at 12 o'clock at night? Do you stop at in 1 in the morning? Is it time to sleep, not sleep? So you're going to, if they're truck drivers, again, you would still have to tell them, we have to try to find you a place that gives healthy food, a salad with some chicken on it, right? Instead of be a hamburger with French fries and a Coke. Take and change your Coke out for an iced tea, no sugar in it, obviously. Taking and try to clean up your diet which means less carbohydrates. So we would take and individualize these people, probably take a look at the route, see which way they're going. It depends on where they're going, again, changes their food. I mean, so it's a really big challenge. And again, you would have to individualize that company to the routes to find out what kind of better food we can get. And then we'd have to talk to them about getting out of the truck and doing exercise, which means going for a walk. Even a walk is better than not doing anything at all. And if you want to do a brisk walk, do a brisk walk. I mean, which means spin the legs a little more, get that cardiovascular going a little bit more, get that where you can't even talk, get that kind of stuff going. So again, most truck drivers are a little bit heavier set, not to say stereotype, but we would have to take a look at those people again, and we would start with walking 30 minutes a day, every day, 5 days a week, and we can give them 2 days off.
Great. Thanks so much, Rodney and Dana. Again, thank you, Wes, for the presentation today. I want to make sure we follow up with the next steps and let you know about sort of what's upcoming. So our first suggestion here is to just learn a little bit more about the impact of diabetes among your workforce. Can you get aggregate healthcare claims data about how many people in your organization are diagnosed with diabetes, or maybe have pre-diabetes? We have some suggestions for how to get some of that aggregate data, but the first thing is know a little bit more about your population. In fact, I think Dana and Rodney's example of how they approach DSMES, of getting to know the individuals that are in their class as well, I think is a model for what we want you to go back and try and find out at your organization at an aggregate, at a population health level. What are people struggling with? How are they being supported? And then we will, in our follow-up, send a link. You can schedule a 30-minute advising session at no charge to review some of the data that you found, to talk about maybe what healthcare coverage your own employer is on, if we have some suggestions for how to support individuals through the diabetes prevention program or through diabetes self-management, education, and support through DSMES. Going to be really important to connect with a communications professional or your communications team at your organization. What we realize is those of you participating in this webinar, you may have access to your employees. You may or may not be emailing them or sending them information directly. Making sure you have a communication strategy so that you're connecting with a communications professional at your organization to get them what's on number 4 here, a campaign about resources available to them. So the other thing that we're going to share is we have a link that we will send to you after this webinar that you could forward to individuals in your organization. It indicates that they're interested in signing up for this DSMES with Rodney or Dana at no charge. And we will get those individuals in touch with Dana and Rodney. We're trying to streamline the process here so the people that need the services can get them in the most efficient way as possible. So these are some ideas as far as next steps, and we will include these in our follow-up email to you as well. And I want to make sure that you're aware of our upcoming webinar. We have confirmed our 2022 calendar, and actually the first one in 2022, how to prevent and manage broadly chronic illness in your workplace, is really building on this conversation. There are chronic illnesses that we've been doing work on: cardiovascular disease, diabetes, cancer supportive workplaces, and osteoarthritis. And we're going to sort of talk about all of those illnesses and how they impact employees at your workplace, and evidence-based solutions and suggestions for individuals to get the preventive and management care that they need for individuals that are dealing with one of these chronic illnesses. And as last, I just want to thank everyone again, our presenters and panelists, for joining us. I thank you all for attending as well. Make sure that when you close out, there's going to be a link that pops up for taking a survey, and we appreciate you completing that and giving us feedback as well as your continuing education information so we can issue those credits that are so important to you. Want to wish everyone a happy, a healthy, and a safe holiday season, however you celebrate in whatever way. And we will be in touch again in the new year. Thanks so much for joining us.